I am Dr. Ashwini Khanna and I am a former State TB officer for Delhi. Presently, I am working as a consultant to Delhi Govt for NTP, and I continue working as a pulmonologist at Lok Nayak Hospital, New Delhi. Drug resistance in TB is a very important issue because most of the patients who are drug sensitive can be treated very well with 6 months of treatment with these 4 drugs which are used for treatment of TB. However, if the patient has not taken treatment properly or irregularly, they can get what is known as drug resistance, which at times becomes difficult to treat. Depending on the severity of the drug resistance, we call it as a multi-drug resistance, and even severe form of drug resistance is called XDR or a extreme drug resistance or extensive drug resistance. So the treatment difficulty is the duration of treatment and toxic drugs which are used for treatment of MDR and XDR TB. Generally, XDR TB is because of the reasons of the bacilli which has developed resistance, and normally they develop resistance to the drugs when these drugs are not consumed regularly by a patient because of the side effects of drug. Patients avoids taking one of the drugs, or when the patient is asked to take 4 drugs or 3 drugs altogether, he breaks them up into multiple doses and takes one drug 3 or 4 times a day. So this is an important reason. Or sometimes the patient is vomiting, is consuming and is vomiting out the drugs every time, and the levels of the drugs which are required to be reached are not reached. MDR TB is what is called a multidrug-resistant TB. Is a form of TB where 2 important drugs which are used for treatment can no longer be used. And XDR TB is again a TB where these MDR TB is there, along with patient has developed resistance, or the organism has developed resistance to 2 more important drugs for treatment of TB. XDR TB is fully curable provided the patient follows a regimen which is given to him. And as of now, a lot of potent drugs are available, and the results which have been seen in various studies, various trials all over the world shows very promising outcomes. At the moment, the duration of XDR treatment is about 18 to 20 months, what we call a longer regimens, what we are used. But however, these days we don't use injections for treating them and we try to avoid use injections. But in very few cases where injections have to be given, then the treatment of injection is about 4 to 6 months. So the treatment as of now is 18 to 20 months. For XDR is 20 months, for MDR is up to 18 months. There's a high chance that they can have a transmission of XDR organism from one person to another within the family. So all the patients who are contacts, and the contacts have to be evaluated for drug resistance TB also. My message to the patients who are suffering from tuberculosis is that 1, it is a fully curable condition, and one should not have break in the treatment, because breaking into the treatment and not taking the drugs regularly will lead to development of drug resistance, and the patient will not get cured and has a poor outcome. So again, I repeat my message: make sure you take the drugs as prescribed by doctor. If you have any issues with the drugs because of the toxicity of the drugs, because of side effects of drugs, please inform them so that all remedial measures can be taken to ensure that you have a better outcome, and that better outcome is always a cure.